This is Jefferson Close-Up, and I'm Carol Celine. My guest today is Dr. Atul Rao. Glad to have you.
Thank you. Glad to be
Now,
here.
you were always interested in science, and you studied molecular biology in college, very scientific stuff, but there was a whole other sort of hidden side of you. Tell us about that.
Well, I don't know if it was quite a hidden side. I made it quite obvious, but there's other things I like to do outside of the sciencey field, and I always spend time goofing around. And I picked up a little guitar when I was in college in one of my goofing endeavors, and played in a few mock bands and pickup bands, and more in medical school than anything, and just kept busy and kept me out of the classroom, I guess.
Did your parents take you back to India a lot when you were growing up?
Yes, they did, actually. Every few summers in my childhood, every 3 or 4 years, we'd head back to India. Over the summertime, we'd spend a couple of months there, and it was a good chance for us to spend getting reacquainted with our extended family, and my parents did it in order to preserve our cultural identity as well, and I think that was a valuable trip every time.
What do you like about being a doctor?
For the most part, it's especially in my discipline, it's affecting a change quickly and seeing a problem and that problem solved, and that's kind of what geared me and pigeonholed me down into surgery, in that we can kind of affect an immediate change. The way to think of vascular surgery is kind of all the blood vessels outside of the heart and the brain. The neurosurgeons deal with the brain, and the heart surgeons or cardiac surgeons deal with the heart. All the other major blood vessels we deal with, arteries and veins. So some of the more common problems we see are what's called aortic aneurysms, or the aorta is a major blood vessel that emanates from the heart, and that can balloon out and grow rather large. We deal with blockages in the arteries, in the neck arteries, the carotid arteries, to prevent strokes, and in the leg arteries as well, to prevent gangrene and amputations and things like that. As well, we do some work with the veins, and some of our more outpatient-based procedures are venous-related, in terms of treating varicose veins and chronic venous ulcers and things like that.
How are you doing varicose veins today? Because I understand those procedures have changed a lot.
They have. The majority of the veins we treat are done with office-based procedures of either, what we use here is a heating probe to heat up the vein, and it closes it down. Other places use laser therapy as well, and that's all from within the vein. We call it endovenous therapy.
What would you say is the hallmark of the way you practice medicine?
Well, I think one of the nice things about what we do is it's a systemic approach, first of all, and that vascular disease involves all parts of the body. And so we're kind of not limited in our scope in that regard. And secondly, we kind of offer a variety of modalities of treatment. We can approach things differently, and we can offer patients different approaches with different risk levels, and have discussions with them. So I think it's a pretty nice field in that regard, in that there's different ways of skinning the cat, and at the same time we're not limited in our scope.
Well, that's very interesting. Thanks for joining us.
Thank you. It was my pleasure.